Hi, everyone. My name is Catherine Morrison, and I'm a lactation consultant in private practice in Atlanta, Georgia. I'm also an international board certified lactation consultant, commonly called an IBCLC, and I'm licensed by the state of Georgia. So I'm here to talk to you today about 3 common issues I see in my private practice and how those issues might impact postpartum mood disorders. I'm also happy to help with information about how to find a qualified breastfeeding helper near you and what the difference is between an IBCLC and some of the other types of breastfeeding helpers. So I'm just going to jump right in. The 3 most common things I see in my private practice are probably not even probably, certainly low supply, sore or damaged nipples, and refluxy babies, or babies that are difficult to feed for a wide variety of issues. So when a lactation consultant is working with a mom with low supply, right, we often come up with a feeding plan that increases time spent at the breast, or increases the frequency of feeds, or increases the frequency of pumping. So those things can decrease the amount of sleep mom is able to get. And sometimes decreased sleep can increase issues with anxiety or depression. So that's something to be alert for. And that's something to talk to your lactation consultant about, your pediatrician about, or whoever's helping you with breastfeeding issues. Also, whenever we're having feeding struggles of any kind, whether it's low supply, whether it's sore nipples, whether it's a refluxy or otherwise difficult to feed baby, feeding issues themselves increase the risk factors for postpartum mood disorders. So keep that in mind. Be watchful of your symptoms, pay attention to those, and don't hesitate to reach out. So as you're working with your lactation consultant, you're going to want to make sure to continually give feedback on the plan you have. So if she's got you on a plan that includes what we call triple feeding, right? That includes some breastfeeding, some supplementing, some pumping, be mindful of how that's working for you. Those kinds of plans are never meant to be used over time. They're always meant to be used as a short-term emergency intervention. So give feedback. Let them know when it's not working. Ask what the alternatives are for that. And know that no matter what, if you need to feed your baby a different way, that's okay too. So moving on to the sore nipples, if we have a good milk supply, that's an easier one to fix. That can typically be fixed with positioning, mom's positioning, baby's positioning. Little adjustments can make a big difference in terms of nipple comfort. Sometimes we have other oral anatomical issues or oromotor issues that can be causing some nipple pain, but a really experienced IBCLC can help you tease out the various issues, help you figure out what's causing the pain. Is it simple positioning? Does baby have a tongue tie? What's involved there? In terms of fussy babies, refluxy babies, just very challenging to feed, that's practically a whole discussion in and of itself. Take videos. Talk to your pediatrician. Show your pediatrician the videos of what's going on with your baby. Show your lactation consultant videos in case your baby doesn't display that fussy behavior during a lactation consult. Give feedback. Say, this is working, this isn't working. There's so much that can be done. So when you're working with a lactation consultant, how can they help? You can Google IBCLC near me to find one, and you can put those exact terms in. And you want to make sure that you're working with an IBCLC or other qualified helper. So check their website. Check their credentials. You can go to the ilca.org website to make sure that they are board certified. You can check with your state. In Georgia, we have licensure, so you can check with your state to make sure they have an active license. So when you're working with one, after you've gone through the steps to find one, and we're going to drop some links in the comments below that will help you find qualified care. What are they going to do and how can they help? They're going to do a complete intake and health history of you and the baby. It can take about 15 minutes to fill out, but it's important that this be done. Someone that's helping you without getting that information doesn't have the complete picture of what's going on with you and your baby, and they're going to be hard-pressed to give you good care. So you want to make sure you're doing someone that's going to do all that intake. Oh, and if you guys have any questions, make sure to drop them in the comments, and I'll answer questions at the end. So you're going to go to your lactation consultant's office, or she's going to come to your home, and she's going to weigh the baby before a feed. She's going to weigh the baby after the feed. She's going to ask you about the health history you submitted. She's going to ask you clarifying questions. Has anything changed between the time that you submitted the intake and the time of the visit, which is happening, with her in the room. And then she's going to assist you and assess a feed. And sometimes baby's not even nursing at all. So she's going to do an assessment of baby. What could be leading to that? Is there reflux? Is there something? Does baby have a head turning preference for one direction? Does baby have a weak suck? Did baby have a difficult birth and has some bruising or some pain or fussiness in general that can take a while to work out? And then she's going to work out a feeding plan after she's assessed you and she's assessed baby. So low supply, I think, is one of the more challenging ones because it requires a lot of intervention, a lot of persistence, a lot of trying different things. We're always trying to figure out, do we have low supply because of some factors on mom's side? Is there a hormonal issue or an anatomical issue with mom? Is there an issue with baby's suck or oromotor skills? So we're going to dissect all of those things to really look and see what's going on there. And then we work out a feeding plan. And we start that feeding plan, and we get feedback from our clients on how that feeding plan works or doesn't work, what we need to change. Because low supply feeding plans are often very intensive and can lead to reduced sleep for mom, we'll often only do them for 24 to 48 hours, or we'll try and build in about 5 hours of sleep at the beginning of the night for mom. So from 9 to 2 or from 10 to 3. And why do we want to do that at the beginning of the night? That's because the missing a pump session at the beginning of the night, pump session or feeding session at the beginning of the night, is less likely to cause an impact to supply. Missing a pump session later on in the night, between 2 a.m. and say 6 or 7 a.m. is much more likely to have a significant impact on supply. Having said that, different families have different goals. And some families will need to, will decide that sacrificing supply is worth it for them in order to get more sleep and stabilize that mood issue. And everybody's going to have a different path that's right for them. What I've learned and what I think is pretty clear is that the most important thing for every situation, for every baby, is for the parents taking care of that baby to be well. So if a baby, the parents of a specific baby are really struggling with a postpartum mood disorder, there is literally nothing more important than doing whatever you need to do to feel better. To be able to be in a space where you want to talk to your baby, where you want to sing to your baby, hold your baby, read to your baby. And if that means we sacrifice milk supply a little bit to get there, then that's what we do. Some parents will feel better doing everything they can to increase milk supply. So then your board certified lactation consultant can help you do that as well. I often tell my patients it takes me a long time to run out of ideas. So I'm counting on them to give me feedback about when they need to course correct, when they want to slow down on trying to increase supply, when they want to slow down and pump the brakes. Are they still enjoying their baby, or is doing the feeding plan taking away from any enjoyment? Is it increasing anxiety or depression? If so, it's time to do something different. I often tell parents that if there's more tears than milk, it's time to do something different. or if the feeding plan is impacting relationships negatively in the house, if it's impacting how the breastfeeding parent feels about the baby or how the breastfeeding parent feels about her partner, maybe it's time to do something different. There is literally nothing more important than the parents, both of the parents or one of the parents in a single parent household, how they feel about the baby and their interactions with the baby. So be really mindful of that. Be gentle with yourself. Don't be afraid to course correct or change things or make different decisions as you go along. I will often tell people the magic is the mom, not the milk. And by that I mean the magic is the parent. That could be the mom, the dad, or the general parent if they don't identify as either a mom or a dad. And it really is. So I'm a supporter of parents, and I will do whatever it takes to support parents. And I think most board certified lactation consultants in general will. They will be responsive to the feedback the parents give about a specific plan, and they will accommodate accordingly. So digging back into, oh, thank you for the comments there. I really appreciate it. Yeah, Allison, I hear what you're saying. So I think it's really important, if you're getting the sense, if you're calling folks on the phone and looking for breastfeeding help, and you're getting the sense that they say, oh, just everybody can breastfeed, just keep going, no matter what, you can do it. If that messaging is not working for you, call the next person in line. You're going to find someone who is going to be open, supportive, inclusive of all of the feeding options, even if that means modifying breastfeeding. I know I'm jumping around a little bit, but going back to that low supply thing, it's really easy to get caught up in the current messaging that breast is best, and breastfeeding does have undeniable health benefits, but it's not best in every situation, because if it's not best for the mom's mental health or the breastfeeding parent's mental health, then I think it's not best for baby anymore, right? I think what keeps the most people in the household the happiest is probably the best for baby. So what I'll often do when exclusive breastfeeding is no longer a helpful goal for a specific family is we'll talk about combo feeding. We'll talk about ways to breastfeed while baby is still actively drinking, and then we go ahead and use a bottle to supplement or a cup to supplement, there's all different kinds of options for supplementing. Different things work for different families at different times. Sometimes when milk supply is very low, we'll even go ahead and start with a bottle supplement. So we're giving baby a bottle first, about half a bottle or 75% of a bottle or even 90% of a bottle, so that baby is calmer, more satiated, more relaxed, so that then we can go take that baby to breast to finish the feed. All right, so that can be a way when supply truly is low and the pumping and the triple feeding aren't going to work, and if medications or herbs aren't an option, and this is just what we're working with, we've got X supply and it's what we're doing, then I do find that supplementing first and then finishing at the bottle is a way to preserve some breastfeeding without a great deal of stress. Other moms will choose to use a supplemental nursing system of some sort, a lactation aid at the breast with a little tube. Other moms find them very stressful, very fiddly, very anxiety provoking. So we try it. If it's not right for a specific family, if the breastfeeding parent doesn't like it, it's not bringing them closer to the baby, we move on and we do something different. Sometimes moving on and doing something different is your board certified lactation consultant supporting you in drying up your milk supply so you can formula feed. It just varies, different things for different people. So I'm going to take a couple. So Allison mentioned that she has insufficient glandular tissue, so supplementation and combo feeding has been amazing for her family. That's great. I feel like I'm a little bit weird sometimes as a lactation consultant, that hearing combo feeding success stories really warms my heart and makes me feel good. I find that in my private practice, 2/3 of my patients come to me with low supply. And in about 1/3 of those patients, so nearly Yeah, and nearly a third of those patients, so a third of the patients I see in general aren't really ever going to have a full supply no matter what we do. So in those cases, I really love to support parents in combo feeding, right? In either doing some bottle first, then breastfeeding the baby, or breastfeeding the baby first, then bottle feeding the baby. The one thing we're really going to want to watch out for is that if we're bringing the baby to breast first, if they're getting frustrated, or if they're starting to resist, or if they're starting to refuse, we want to make sure to go ahead and start offering the bottle first. Happiness at the breast and happiness with feeding are always worthy goals. Always worthy goals, no matter where we end up with feeding. We want the baby to enjoy feeding. So if they're frustrated with a low supply breast, we don't want to start there. We want to start with some food. We want to help take the edge off their hunger. We want to get that sucking organized and then bring them to the breast after they're calmer and happier. If baby's calmer and happier at the breastfeeding parent is also going to be calmer and happier with breastfeeding. And since we know feeding issues are a risk factor for postpartum mood disorders, we want to reduce the feeding issues. We want to keep the happiness. We want to preserve the relationships. I'm going to check my notes here to see if I'm missing anything. Oh, so how can you tell if you have low supply? There's often a discussion in the lactation community on whether parents are seeing perceived low supply or real low supply. I think it's different in different places. In my population, it's very rare that I have someone come to me with perceived low supply that doesn't actually have low supply. In other words, when someone tells me they think they have low supply, they almost certainly do. It's very, very rare that I say, oh, look at that. Your baby just got 3.5 ounces in 10 minutes. Your baby was just fussy or was finished eating, right? Usually the moms who tell me, I think I don't have enough milk, they don't. And it's usually not just because of a breastfeeding management issue. It's usually because there's a primary supply issue in my patient population. So what we'll see is a baby who is feeding far more frequently than is typical. 8 to 12 times is very typical. But 16, 18, 24 times, that makes me want to evaluate feeding and see what's going on. If baby is hard to console and really nothing is working, you know, this baby has been crying at the breast and they're constantly, nothing else works to console them but being at the breast, that makes me wonder if baby's getting enough. If baby's only happy at the breast, but every time they're moved away from the breast, let's evaluate breastfeeding. Let's do a pre and post feed weight. Let's see what's going on. Absolutely, infants have needs to be close to their primary caregivers. That's normal, 100% normal. But if baby is constantly fussing if they aren't on the breast, that's not typically an indication of a good supply. Nursing constantly, never seeming satisfied, so that's fairly it. Sore nipples, well, we know the symptoms of sore nipples. Reflux and other feeding challenges. You might see symptoms of reflux if there's evidence that you have lots of milk, right? There's just milk dripping, pouring out. Baby goes on and drinks well initially and then starts pushing and arching. And you see that, you know, they're really pushing and arching, even though there's lots of milk. And initially there's often decent growth, and then over time the fussiness increases. We'll often start seeing fussiness related to reflux, start seeing it appear a little bit around 2 weeks of age. Usually by 6 weeks of age, we're kind of in full-blown reflux mode, if that's an issue. I often ask parents, if they're having reflux issues, to go ahead and take video, because it's hard for the pediatrician to really get a sense of how significant the feeding issue is unless they see evidence of it. If it's reproducible by feeding the baby, feed the baby in the waiting room so the pediatrician sees it. Get help, insist on help, take video, show people, make another appointment, go back. Don't give up on that. If we can get that treated and managed, then feeding issues reduce. And if feeding issues are well managed and reduced, then mom's going to have, or the breastfeeding parent's going to have a better experience feeding their infant, which can often dampen down anxiety and depression and other postpartum mood issues. So does anyone else have any questions?